So we are here today to learn the connection on how the effects of poor dental health can have on your body. Generally, people think that a standard dental visit is to prevent, you go to the dentist every 6 months, get cavities checked and how your teeth are being cleaned. However, there's research that indicates there's a systemic problems occur due to poor oral health and vice versa. And these diseases are directly affected by the bacteria that's associated with an unhealthy mouth. So some of the things that you can see is it affects the mouth where you have bad breath, gum disease, tooth loss. It affects the respiratory system.
Your internet connection must be...
It affects the cardiovascular system. It affects our joint system. I'm sorry.
Your internet connection is going in and out a little bit.
Oh, I'm sorry. Just let me do one thing.
I didn't mean to chase her away.
No, I'm back. I'm back. I had actually shut the door. So yes, I was mentioning to Sharon, I am having a little technical difficulty, but remind me, I can always move to a different computer station. But thank you. So
I can help with that whenever you're ready.
Okay.
Just kidding.
Okay.
And I can get you a new house and a better reception area. Just joking.
Okay. I'm up for that. So some of these conditions which are directly affected are cardiovascular system. So cardiovascular disease, stroke, Alzheimer's, diabetes, sleep apnea, hypertension or high blood pressure, colorectal cancer, lung diseases, rheumatoid arthritis, osteoporosis, kidney disease, pregnancy, and obesity. So the fact is that our mouth is talking to our body and the body is talking to the mouth. So a lot of things go on, and if we ignore one, it affects the other, vice versa. So how can we know more about it? I'm just going to talk briefly, go into depth of some of the more key things that we see. And so what is cardiovascular disease? Cardiovascular disease, also known as heart disease, it causes numerous problems which related to a process called atherosclerosis. So, and what is atherosclerosis? It's a condition when substance called plaque, it builds up in the walls of the arteries. This causes narrowing of the arteries and makes it harder for the blood flow. And so if a clot forms in the heart, it leads to a heart attack. If it goes to the brain, it's a stroke. Some of the cardiovascular disease which are included are aneurysm, angina, atherosclerosis, a stroke or cerebrovascular accident, cerebrovascular disease, congestive heart failure, coronary artery disease, heart attack, also known as myocardial infarction, and peripheral vascular disease. How does that affect everyone? It's because your mouth is also related to the heart disease. And how do we explain that? The explanation is there's a direct link between the periodontal disease and heart disease. Why? Because pathogenic bacteria, which lives in our mouth, can enter the person's bloodstream and migrate to the vessels in the heart or the numerous capillaries. And what it does, it attaches itself to the fatty plaques, and this plaque becomes a clot. And if the clot will restrict the healthy blood flow, preventing the necessary amount of oxygen and nutrients reaching the heart. This condition can lead to a heart attack. So research has found that individuals who have periodontal disease are nearly twice as likely to also have coronary artery disease. And what are the treatment options? Because periodontal disease can exacerbate heart conditions. We need to make sure that the patients are in control of both. So how does it affect our heart? If somebody has periodontal disease and they may require antibiotic prophylaxis because to prevent something called infective endocarditis, which is inflammation of your heart. And the dentist and your cardiologist should be able to determine if your heart requires those antibiotics prior to any dental procedure. What is high blood pressure? So high blood pressure is a common condition which forces the blood against your artery walls high enough so that it may eventually cause health problems such as heart disease. In majority of patients diagnosed with high blood pressure, the cause is not known, so it's unidentifiable. There are numbers of medications or medical conditions that can also lead to secondary hypertension. Normally, the blood pressure should rises steadily from 90 by 60 at birth to about 120 by 80 in healthy adults. Blood pressure is determined by the amount of blood in your heart can pump and the amount of resistance to blood flow in your arteries. In the US, there is more than 30% of American adults have high blood pressure. Hypertension is also the leading cause of stroke and a major cause of heart attacks. Hypertension not just injures your blood vessels, it causes damage to the brain, eyes, and kidneys. How is it related to your mouth? When we see every patient, we monitor or we check their blood pressure, because blood pressure or hypertension is a silent killer. It's a silent disease. And what is the correlation? There's a substance called C-reactive protein, which is a marker for systemic inflammation, and that is associated with the risk of increased risk of the heart attack and stroke. Oral inflammation also is contributory to play a role in the development of hypertension, because there's evidence that demonstrates higher C-reactive protein amongst individuals who have elevated blood pressure. What are some of the symptoms that we see? We don't feel it or don't know it because it's a silent killer. Because unless it's a very severe, higher, dangerous levels of, which is systolic of 180 or more and diastolic 110 or higher, that some obvious symptoms occur. So some of the symptoms that patients feel is headaches, severe headaches, anxiety, shortness of breath, and nosebleeds. But this is when it's at a dangerous high level. How can we help, and what are the treatment options? Eat a better healthy diet, reduce the salt intake, enjoy physical activity, which is more getting yourself on a lifestyle changes, maintaining some healthy weight, managing stress, avoiding tobacco, comply with prescription medication, and limit alcohol consumption. In view of the dental field, how does that work? It's because we can limit the kind of anesthetic that we provide for any procedures, monitor the patient prior to any invasive procedures, and make sure that whatever we do in the dental office, it's not affecting the blood pressure of the individual or causing it to elevate. Okay, let's talk about lung disease, especially at a time like this where everyone is listening to stories and a lot of misinformation is out. We want to know what's lung disease. Lung disease is any condition that inhibits the healthy functionality and is classified as lung disease, and it can be divided into three categories. One is disease of the airway, and airway means the tubes that transport gases like oxygen and carbon dioxide from a person's lungs. There's lung tissue diseases which affect the structure of the lung tissue, and circulation diseases that affect the blood vessels in the lung. Chronic obstructive pulmonary disease, or COPD, is one of the most common lung disease. And the two main forms of COPD, chronic bronchitis, which involves a long-term cough with mucus, and emphysema is what involves damage to the lung tissues over time. And why is it important? Tens and millions of people are suffering from lung disease in the US. And smoking, genetics, infections like periodontitis are also responsible for the lung disease. So as a dentist, I can see my patients and I screen people for any kind of nicotine use, and that contributes to the lung disease. Some of the symptoms you see as shortness of breath or dyspnea, and this is when you're trying to breathe, but it's breathing is harder and you feel like you're running out of air. There's a persistent cough or coughing up of mucus. There's difficulty or labored breathing during physical activity or while resting. Wheezing air, which is, air is trying to flow through a narrow airway. Then there's higher frequency of pneumonia and lung infections. How is it related to your mouth? Well, studies have shown that there is a fair association with pneumonia and oral health, and there's evidence that exists that proper and improved oral hygiene and frequent professional oral health care reduces the progression of and the occurrence of respiratory disease. And this is especially in higher risk elderly patients in nursing home or those who are in ICUs. And even at a time like this, the pandemic, when we are covering up our faces with a mask, it's very important to not just protect us from external bacteria, virus, and diseases, but also what our breathing quality and the air we are breathing, and that kind of changes. So because there is the association between periodontitis and chronic pulmonary diseases, this is important. Your oral healthcare is important. So what are the treatment options for any lung diseases? Lifestyle changes, which include avoiding alcohol, losing weight, quitting smoking, pulmonary rehabilitation programs that combine education, exercise, nutrition, and counseling. Some may require supplemental oxygen or bronchodilators or anti-inflammatories. One of the other things that often we see is asthma, allergies, and congestion. And why is that important? Nasal breathing is the preferred method of breathing. Why? Because it warms, filters, and humidifies the air, and it decreases the number of irritants that enter the body. These irritants increase lead to the allergies and asthma. When mouth breathing occurs, there's increase in the size of the adenoids and tonsils, further decreasing the functional airspace, and then it necessitates the individual to mouth breathe. Mouth breathing can cause improper tongue posture, leads to an unbalanced muscular system within the oral cavity, and this unbalanced system can cause a deformation of the jaws and lead to malocclusion. One very important aspect of the oral systemic connection is sleep disorders. And what is sleep disorder? Sleep disorder is a condition that impairs a person's ability to get normal restorative sleep. And this causes conditions are variable and range from habits people have developed before they go to sleep to a number of medical problems that disrupt the normal sleep cycle. Sleep disordered breathing is a condition characterized by repeated episodes of hypopnea and apnea, which is underbreathing or not breathing at all during sleep. And this causes temporary elevations in the blood pressure with the association of lowered blood oxygen levels. And this leads to elevated blood pressure during the daytime and continued sustained high blood pressure with time. Sleep disordered breathing causes your sleep cycle to reset multiple times, and it increases the risk of heart attack, stroke, abnormal heartbeat, and atrial fibrillation. So if you feel that you have a pattern of not feeling rested in the mornings when you wake up, you should probably see your doctor and get an evaluation to determine if you have a sleep disorder, because sleep disorders can have a profound effect on the person's overall health. It is important to even evaluate children. And so this slide here is a pictorial representation of a lot of commonly seen uh, symptoms around us. You will see individuals who snore, have crooked teeth, people who suffer from depression, fibromyalgia, ADD, asthma, chronic allergies, ADHD, hypothyroidism, diabetes, anxiety, hypertension, aggression, dementia, and Alzheimer's, cardiovascular disease. A bunch of all of these symptoms are very commonly seen in this modern society now. What happens is a lot of these symptoms have been found to correlate with an underlying root cause, which is related to sleep and breathing. So it's a sleep-related breathing disorder. And lack of sleep can be life-threatening. For example, car accidents, personal problems, poor job performance, injury, memory problems, mood disorders. Why is it important? And this is why. Am I being heard or seen because my internet? Okay.
Yeah, you're cut out a little, but we can see you.
Okay. Could we hear? Or okay. Thank you. Sorry, I'm just checking because, and apologize for that. So some of the common symptoms that are associated with obstructive sleep apnea, and this is again, you're commonly seen people around you. There's depression, there's forgetfulness, irritability, headaches, and restless sleep. Daytime fatigue, snoring, dry mouth, gasping for air, sore throat, night sweats. And this is results in a 40% of people are affected with ADHDs, like Alzheimer's, 73% associated with sleep disorder, 45% depression, and stroke, diabetes, heart failure. All these symptoms connect to the rest of your body, and it's a lot to do with how we sleep. The next slide, this is a little video presentation, and this will explain what's going on.
Airway and TMJ. A normal way to breathe is through your nose. As we grow and develop, certain things such as pollen, cow milk, and other variables can cause an allergic reaction, causing the lymphoid tissues known as tonsils and adenoids to become swollen. As the tonsils and adenoids become swollen, they develop into an obstruction for nasal breathing, and slowly mouth breathing begins to be the primary intake of air into the body. In order to breathe through the mouth, the lower jaw comes down, the tongue comes off the palate and settles on the lower teeth. Nasal breathing is the correct way for air to enter the body, and during nasal breathing, the tongue rests at the palate and the pressure of the cheeks is balanced by the tongue. During mouth breathing, the pressure from the cheeks is unopposed by the tongue. The oral system becomes unbalanced and results in the deformation of the upper jaw, creating a V-shaped arch as opposed to a correct U-shaped arch. This also produces an incorrect swallowing function. Upon swallowing, the tongue rests on the lateral teeth, hindering normal tooth eruption, causing a lateral tongue thrust. A constantly open mouth causes the incisors to over-erupt.
Okay. So this kind of explains what...
The result is a deformation of the lower arch known as the bicuspid drop-off. The result of this deformation of the upper and lower arches is the presence of premature contacts upon closing, which shift the lower jaw distally off of the physiologic trajectory. The narrowing of the upper arch pushes the lower jaw back. This forces the TMJ condyle to shift distally while the TMJ disc shifts forward. Upon opening, the disc can shift onto the condyle to restore the TMJ's correct position, reduction of the disc, and then shift back to an incorrect forward position upon closing. This is what causes a reciprocal click. In addition, the muscles could be in a state of hypertonus or spasm, which can result in tension headaches. An incorrect position of the lower jaw can result in parafunctional activity of the muscles, such as clenching and grinding. Over time, grinding can result in severely worn down teeth, As a result, the teeth become even shorter, the lower jaw shifts distally even further, and the vertical of the bite decreases. In time, joint degeneration occurs. The joint becomes deformed, and the ligaments of the joint become damaged. As a result, the TMJ disc can get trapped in front of the condyle. While the click may go away, limited mouth opening will occur. A distally shifted jaw and tongue positions result in even further restriction of the airway. In order to open up the airway, the neck moves forward and the head tilts backwards. This stresses the spine and fatigues the neck muscles, which results in neck, back, and shoulder pain.
Okay, so the next so this is a list, and you can take a screenshot if you want. This is a checklist of sleep apnea symptoms, and this is some things you may or may not have. One or two things going back. Sorry. Sorry. And that you wake up suddenly with choking or gasping sensation. Your spouse or bed partner says you stopped breathing. You snore loudly. You wake up in the morning with dry mouth and sore throat, headaches in the mornings, frequent feeling tired and fatigued during the day, difficulty staying awake while watching TV or reading, or traveling by car as a passenger, having irritability and mood swings, difficulty remembering things and paying attention at work, high blood pressure, decreased sex drive. Common factors associated with OSA is also being a smoker, overweight, or obese. And having all this relates to the way a person, some of the problems that occur and which is seen are, these are red flags, and the comprehensive testing actually will prove what you're at risk for a heart attack, stroke, or diabetes. The personal or family history of a heart attack, stroke, type 2 diabetes, history of cardiovascular disease, diabetes, gestational diabetes, elevated cholesterol, nicotine use, any of these actually are red flags. So I'm gonna go over to the next slide. And this is a quote from Dr. Amy Doneen, and she's practices, one of the co-founders of the Bale-Doneen method of how to treat cardiovascular disease and undo and change back. So she says there's more than a correlation between healthy gums and a healthy heart. There's direct link, also known as your body's cardiovascular system. So how can we do and undo things that damage that has been done? Following a 4-step plan to protect your oral health can lower your risk for heart attacks, stroke, diabetes, cold, flu, arthritis, and even some forms of cancer. In a recent study, 5,600 older adults found that one of the simplest, most effective keys to a long-lasting life is combining regular dental checkups with excellent self-care, including daily brushing and flossing. So how do we do that? Step 1, partner with your dental provider and set goals to take your oral health to the next level of excellence. Ask your dental provider to test you for high-risk oral bacteria. Disinfect your entire mouth daily. Get a dental cleaning every 3 months or as advised by your dental provider. I shared a slide earlier with the tree, which denotes all the signs and symptoms. And why this is so important is there's a silent crisis going on in America. And a lot of these symptoms like ADD, bedwetting, difficulty in school, mouth breathing, snoring, restless sleep, delayed growth, crowding, chronic allergies, and in adults like depression, anxiety, obesity, hypertension. is very noticed, very common. Just because it's common, it doesn't mean it's normal. And this is the reason why we need to screen, why we need to take care. Children often are very vulnerable, and children show like the most common chronic disease of childhood is tooth decay or cavities or caries. And untreated cavities can cause pain and infection. So not only does it interfere with their eating, speaking, but it also affects the patient's, the children's self-esteem. Also, children are more sensitive to breathing issues, as it is during these areas that it is affected, that the development gets affected, and all developmental alterations which are associated with breathing are completely reversible. Some of the common childhood conditions that can be linked to sleep disordered breathing is due to the underdeveloped jaws, and as commonly seen, asthma, allergies, poor growth, ADD, ADHD, bedwetting. Signs of the underdeveloped jaws, upper and lower jaws in children, are limited spacing between baby teeth. And when there are the baby teeth, we should have a lot of spacing in between them. That's normal. But we see crowded teeth, we see buck teeth, we see forward head posture, we see kids with very tired looking eyes, chapped lips, and this is all related to mouth breathing. This next video is going to share why this is important and how we have reached, it's become an epidemic.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. In the 1800s, orthodontists in favor of extraction were looking for more effective ways of pulling teeth back, and this is where the story of headgear starts. Not understanding the cause, those orthodontists believed in a myth that in buck-toothed children, the upper jaw was overgrown. They thought that if they restrained its growth with headgear, the lower jaw would catch up and the teeth would line up. Although studies done throughout much of the 1900s have shown otherwise, this myth became a part of the foundation of conventional orthodontics. First, studies have shown that headgear suppresses the growth of both jaws, causing them to grow down and back into the airway, creating a clockwise rotation of the lower third of the face. The industry coined these deformities the headgear effect. The growth changes caused by headgear carry on into adulthood. In order to breathe, She will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. A simple physics diagram shows that the growth-stunting forces of headgear pass right through the skull. One study showed that headgear caused an abnormal rotation of the sphenoid bone, and no study has examined the impact of headgear on the skeletal blood flow and nerve pathways of a growing child, or its long-term effects. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition. However, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. If you have already been exposed to orthodontic treatment that caused the headgear effect, there are ways to reverse what happened. If your child wears a headgear or is exposed to an appliance or practice that retracts structures involving tongue space and the airway, his or her lifelong health may be in danger. There are plenty of alternatives to these practices, so make sure to get multiple opinions. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits. There are better ways. Right to Grow is an organization dedicated to ending the practice of orthodontic growth stunting. Please sign our petition online, share this video, and get involved in making the world.
So the next next slide is the correlation of ADD and ADHD in children, and why is it important? Why do we see it connected to sleep disordered breathing? This is probably the bedwetting one, sorry, okay. This is why bedwetting, one of the common...
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best kept secret. Not many people are running around and advertising that their child is bedwetting at the age of 5, 6, 7, 10, 14 years old. But bedwetting does have a relationship to how we're breathing and our quality of sleep. And some of the causes for bedwetting relate to the way oxygen is exchanged in our body. And the way I'll describe it is this. If we're breathing through our mouth, that air coming into the lung isn't really filtered, warmed, or humidified appropriately, and the body can't exchange it appropriately. So a little less oxygen goes to the brain. Now, the brain is a very sensitive organ. When the brain recognizes little changes in oxygen, it goes to work immediately. Because once the brain starts to recognize a little less oxygen, it doesn't know if we're being choked to death, a very serious condition, or if there's an imbalance in how we're breathing at night, but it does start to trigger a little bit of the fight or flight response. And a little bit of the fight or flight response means the brain's going to look at the body and say, all right, if we've got a little bit of an oxygen issue going on, I'm going to pull oxygen from something that it picks to be unnecessary right now and maybe deliver it somewhere that might be more important, planning on a rare occurrence as if the oxygen was going to stop. So if the brain's recognizing a little less oxygen, all of a sudden it's pulled from the urinary tract. If the body pulls a little oxygenation from the urinary tract, it might void. So we might wet the bed.
Okay. The slide headings interchange. This explains a correlation between ADD, ADHD, and sleep disordered breathing.
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best kept secret. Not many people are running around and advertising that their child is bedwetting.
Sorry, okay, I'm gonna move on to
At the age of 5, 6, 7.
So unfortunately, that video clip got moved. So I'm just I can share with you all in a later date, but it talks about the correlation between ADD, ADHD, and sleep disordered breathing, because 50% of children who are diagnosed with ADD, ADHD don't require that diagnosis. Studies have shown that children who are affected with fragmented sleep or poor sleep, they exhibit the same symptoms and behavior as ADD, ADHD children. So there is a chance that every child who's put into this pharmaceutical regime of having medications which kind of excite them and then they come down is not needed. What we definitely want to see and do is evaluate a child for a possible sleep disordered problem or fragmented sleep or sleep deprivation, and then eliminate the need for medication. So why is this important during this current pandemic? We are getting a lot of misinformation, but there definitely, CDC has said there are two significant factors that relate to obstructive sleep apnea and also serious complications from COVID-19. One of them is chronic health conditions and age. The third factor is also patients utilizing a CPAP machine, and that causes sleep aspiration. So coronavirus has caused a higher mortality rate for patients with underlying health conditions, like the chronic conditions like diabetes, heart disease, lung ailments, etc. But they are also affecting normal individuals if you are unable to breathe properly, breathe through your nose. So I will be sharing some tips and tricks just in a little bit. Okay, so some of the good oral health practices that you can do is to maintain a balanced diet with plenty of fruits, vegetables, whole grains, and low-fat dairy products. Avoid food with high concentration of sugar or starch. Dentally, they stick to your teeth, so drink plenty of water, hydrate yourselves, brush gently at least twice a day, and with attention to the gum line. Use soft brush or an electric toothbrush and some fluoridated toothpaste. Floss at least once a day. I recommend twice, but at least I implore once a day. Replace your toothbrush 3 to 4 months, and especially if you're feeling sick or you have been sick, replace your toothbrush. Be aware of bad habits like ice chewing and crunching on hard snacks. That's going to cause some micro fracture and crack your enamel and break teeth. Grinding and clenching. If you are aware or that you are doing that, you need to be evaluated because that could be an underlying condition. Wear a mouth guard if you're doing a sport or activity that causes trauma to your face and jaw. And especially in social distancing activities, you can do like mountain biking or rollerblading. Make sure that you're safe with a helmet and a mouth guard. So what can you expect if you go to your dentist? Some of the changes which COVID has brought is that when you're experiencing a different kind of a dental visit, our office is taking extra measures to keep you and your family safe. And some of the things we are doing is a pre-screening, and that is prior to scheduling a visit. We are asking questions related to make sure that you do not have symptoms of COVID, and also that if you've been exposed to people around you with COVID. We will be asking the same questions on the day of your appointment. We are checking your temperature with the infrared touchless thermometer. We are also checking the oxygen saturation level with a pulse oximeter. We are also asking the same questions every time you come in. We also are staggering the appointments so that everyone is safe and there's social distancing and cross-contamination is eliminated. How it has affected that our waiting rooms are looking different. We have removed all the amenities that we used to offer, but we will still offer you on a one-on-one basis. It's not out there to self-help, because some of the magazines and toys are very difficult to do infection control. We have removed it from the waiting rooms. And if you have any questions regarding your dental visit, you are more than welcome to ask anybody on the team. We are happy to walk you through with all our procedures and checklists. And our staff is geared up more. Everyone's been trained for improved level of disinfection and safety, and safety measures. So you may see additional devices around the office, like we have screen guards and sneeze guards. We have HEPA filters throughout the office. We have additional external devices to take care of the aerosol while we are doing procedures. So there is no better time than now to start healthy living. And these are some of my favorite pictures. This is my operatory, and I wanted to share my laser, which I love using. And these two are my golden retriever puppies, Piper and Hazel. And the reason is that I do enjoy this. I enjoy my work-life balance, and this is what I look forward to. And thank you for having me. And I am open to questions.
Who does the dental work on those golden retrievers?
Well, I have to find. I guess I have to find a way to get someone to do dental work on them. Right now, we are brushing their teeth; they're healthy.
I'm just joking. You did say to disinfect your mouth daily. How do you recommend doing that?
So using I recommend alcohol-free mouth rinse. So the daily protocol is like you brush your teeth, make sure that you disinfect your brush handles, you clean your brush and keep it to dry. Don't keep it near the toilet. Do not keep it with a bunch of other people's brushes, like even if it's your family, because if someone gets something, you're not transmitting it. Disinfect with mouth rinse. Like if you can use anything over the counter like Listerine. I prefer recommending zero alcohol because a lot of people have sensitivity issues. If you have dry mouth or something, then alcohol dries it more. Hydrate yourself and wash hands even after brushing. Do not touch your mouth, eyes, and nose because those are areas of more susceptible how you transmit it. So, yep.
Okay.
If that answers your question
That
about
does. Thank you. Thank you.
A lot of great information there. It's a lot to absorb.
Yes. Actually, my team was reminding me that I can, in my excitement to share all the information, some of it can be very overwhelming. But the reason for is not to overwhelm, it's to educate. And a lot of the dental offices do not do what we do. But again, not to scare you, because just sharing the information, the better informed we are, we can take healthy uh, decisions to make our health a priority. And I think one of the key things that has happened from this pandemic is that people started getting more aware of their health, and they want to make sure that we don't want to be more susceptible, because we don't know what's going to happen with the world around us. But we can take our health in our hands and just prioritize our health.
Is there any food that you recommend for your teeth?
Well, to be specific, avoid hard. Okay, so like I'm guilty of this, and I have suffered the consequences. I used to chew ice, okay, and I love crunchy snacks, but they are not the best for your teeth. So hard candies, I would avoid, caramelized apples, stuff like that. If you have crown and bridge work, do not go ahead and eat sticky food, because that's going to cause the constant motion of moving. So that will debond your crown. It's going to cause that. Hard candy is not good, but it takes. And one of the key things is, if you're eating or drinking any uh, liquids like juices or coffee, tea, and red wine, whatever we're drinking and eating, make sure you're doing that within a 20-minute time, because the more time food sits on your in your mouth and drinks, it creates increases the acidic environment inside the mouth, and that causes the enamel and to wear, and there's attracting more and more bacteria. It increases the ability of the bacteria to directly get in touch with your teeth. So very important to brush, floss, and rinse.
Okay, thank you.
Does Gail has a question? We have to unmute you, Gail.
You said 20 minutes. You mean we need to drink our coffee or tea or wine and then go brush our teeth inside of 20 minutes? Is that what you meant?
So, like, for example, and this is like you have a cup of coffee and you're eating your breakfast, go ahead and do that. Just make sure to rinse your mouth after. If you're sipping coffee for, like, say, 3 hours, you have the same cup or a giant glass of sweet tea and you're sipping it throughout the day, you're providing more, you're taking the pH balance of your mouth is becoming more acidic, and bacteria will thrive. The enamel gets more susceptible to, like, it's putting something in vinegar. So the acidic environment will break down the hardest substance in the body, which is the enamel. So, and bacteria can act on it, and you're prone to gum disease and dental decay.
I understood that part. I just was making clear on the 20-minute.
Yeah, it's because of the pH level. And yes, then rinse your mouth. And if you want a second cup of coffee, have it, but just try to drink it within 20 minutes.